So, nearly 7 o'clock in the morning, and I'm going to catch a train to Brighton for my pre-assessment. I've been clubbing all night. I'm freezing cold.
Hello ladies and gentlemen, welcome to my YouTube channel. I'm just doing a video today to give you an idea of what happens at a pre-operative surgery assessment. You've just seen a video of me walking through Liverpool after going out clubbing to go to my appointment. So I'd recommend that you stay in a hotel in Brighton and not do what I did, because I was very tired after that. So when you go through a pre-operative assessment at Brighton, you need to bear a few things in mind. Well, firstly, they're going to check you for, like they do everything when you're going through the gender process. They're going to check that you've had a diagnosis, that you've been in transition for 2 years, and they're going to also want to check your BMI. Now, they asked me this on the phone. They didn't actually check my BMI at the appointment. They checked my weight when I went on the phone, but they didn't actually check me in person, which was interesting. But I'd recommend that if you're going through this process, you make sure you keep under that 28 BMI. I've been doing this by carefully watching my weight and counting calories, and I've actually managed to drop from 106 kilograms at one point down to 97/96 at the moment. So it is possible. That's 96 kilograms I'm currently at. So it is possible for you to lose the weight needed for surgery. You really just need to watch those calories. I wouldn't recommend any fad diets. Just eat a healthy diet and calorie count. If you're going out for a meal with friends, just have some light lunches and light breakfast. It really is that easy. Now, of course, you should probably do exercise and everything, but I'm not one to talk about that because I'm not a big fan of exercise. I do my bit. I go for walks, I go hiking, but I'm not one for going to the gym. I just go jogging, that's all I do, and they seemed happy with that. So when you attend the appointment, you're going to sit down with a doctor and a nurse, and he's going to ask you those questions, like how long have you been transitioned, have you been on hormones for very long, and they're basically just going to check that you're following the pathway in order for you to be a suitable candidate for surgery. At that point, he's going to do a little examination on you, look at you, and see how much tissue he's got to work with. It's not anything strenuous. I would just like to use this video to alleviate any fears that you might have about gender clinics, some of the horror stories of the past. I think those days are largely gone, and I think you could present anyway and they would be pretty accepting. It's a very pleasant experience for me. I obviously don't pass very well as a trans woman, and I'm okay with that, and they were okay with how I was dressed. They didn't make any comments or anything like that. They were very accepting, and in total they answered all my questions. And after he did the examination, he then went on and he just went through some of the risks of the surgery, and he gave me the option of whether I wanted a skin graft to get more depth. I personally don't want that because it's not something that I'm worried about, but I think if you're going to go ahead and do this, you probably want to consider those options of whether depth is important for you when you have this surgery. One of the things I would suggest, like I say, is don't make the mistake that I made. Make sure you book yourself in a hotel and you get a taxi to the hotel to the hospital. The Brighton hospital was on the outskirts of Brighton. It's like a 10-minute drive in a taxi. There's quite a lot of selection of hotels in Brighton. If you're budget conscious, it's not a particularly expensive place to stay, but it's not as cheap as like Blackpool. I think if you look on hotels.com or some other website like that, you should be able to get a good deal. So in another video, I'm going to talk about some of the risks that you have on surgery and some of the associated problems. But for now, I just wanted to ease your minds in that when I went, he didn't check my weight. But you really want to get under that 28 BMI that you need for surgery. And I just want to say the Brighton Hospital is looking really good so far. It looks like a very nice hospital. And if you've got an appointment there for pre-assessment surgery, I wouldn't worry yourself too much about what it's going to be like, because they really are willing to answer all your questions. They give you a big pack of information that all you need for your surgery information. But one of the things you probably want to bear in mind is for surgery, he said to me that I've got to have 3 months off work. He was pretty adamant about that. And I really would give yourself that width and depth I would try and make that possible if you can. You want to make sure that your recovery is as best as possible and that you have the right appropriate support for when you have this surgery. I'll be releasing some more information and videos about gender reassignment surgery after I've edited this, and maybe in a few months. I'm going to completely blog my surgery. It won't be till to like July, but then I'll be releasing a video out there to help you. I hope this video helps you. Feel free to ask me any questions in the comment section or anything. And subscribe if you're into travelling or cruise vlogs, because I'm going to be doing that. I think a lot of people have asked me what I'm excited for surgery, and I think that's probably the most thing I'm excited for, is to get on a cruise ship and go to a spa after I've had the surgery and not have to worry about, you know, that awkwardness, trans awkwardness. Obviously not everyone has surgery who's transgender, but I feel this is, for me, it's a very practical surgery. Like, it's going to be nice to be able to wear clothes and not have to worry about things. I'll see you later, YouTube. I'll see you in a bit.